Welcome to another episode of Progression of Perception. Today, we're going to talk about
low back pain.
Well done. Low back pain, probably the most common musculoskeletal condition that a lot of people deal with. So, as we've been doing with Progression of Perception, let's simplify it. Let's break it down into 3 ways to perceive pain differently. With low back pain, we like to really simplify it into 2 motions, either bending forward or being straight. Does it hurt more to sit or does it hurt more to stand? And from there, we can really start to come through a singular process of getting better and really teaching yourself, your nervous system, your body, and shaping your environment to get better. Here's how.
So oftentimes, the narrative is always to avoid moving into the movement when it causes pain. But more often than not, with low back pain, we're seeing gradually getting back that motion back into those movements that are painful is the best scenario for long-term getting over low back pain. So one of those things we can start with is if you're having pain with standing or extension of the low back. And one way to ease back into this, instead of pushing off the floor, is we can start on our knees and our hands and slowly allow our hips to sit down towards the floor, let it almost sink in like it's melting completely, and then come back up, right? Each time we go further down, it gets into more extension of the low back. And if we slowly, gradually do this over time, what we're looking to see is improving the symptoms of that extension of the back by getting through it in a different way.
So we just looked at if you have pain with standing or being more upright. Let's look in the other direction. Let's say you have pain with sitting or just being bent over. Here's the progression you can do for that to change the perception of how you feel pain in those positions. So start in the same position as the standing one, all fours. This is a really safe, low threat way to start. So we want to have a little bit more bend. We're going to start that way. So in this position, you're going to just gently sit back. So this initiates that bend in your low back. So that's the first one, a gentle one. Then you can do that a little bit more by bringing your arms a little closer to your knees and sit back a little bit more. So every time you get just a little bit more bending, then you're gonna bring your elbows down, and that brings you down even more. Again, you could see that curvature happening. How fast you do this really depends on you and how you tolerate them. This could be in one session, one exercise. It could be over days or a little bit longer than that. It depends on you and how you tolerate it, but you have to do little by little, more and more, just so your body gets used to these positions. Then you're finally gonna sit all the way back, bring your head down, and then bring your back up to create this nice overall curvature. Again, do it gently. It should feel really good. It might be a little sore the first few times you do it, especially if this position is painful, but the more you do it, the more your body will get used to being in these positions and know that they are safe and perfectly fine and normal to do. So that's our progression of perception for low back pain.